Today, we're getting under the hood of women's health with Dr. Bernie Russell, a board certified OBGYN based in New York City. Dr. Bernie is a daughter, mother, advocate, counselor, and friend who focuses her work on trauma informed gynecology and focuses her play on connecting thinkers, makers, and empaths to advocate for a world where we recognize and celebrate the human journey. Dr. Russell will get under the hood of bone health.
So I'm a gynecologist in New York City, and I have had the privilege of practicing in different environments for over 24 years. Um, I've had a private practice since 2008, and in that time frame, I have watched my patients grow as I've grown, and I've had the opportunity to learn and grow from patients, uh, through this entire time. Bone health is really important to discuss with women, not only in the post menopause, but throughout life, because osteoporosis and more importantly, falls with osteoporosis. A woman who is in her 80s, for example, who has a fall and breaks a hip, has an 80 over 80% chance of dying from that. So prevention occurs before she falls and breaks her hip. Prevention occurs and conversations occur with women in their 20s and 30s about diet and making sure that they are consuming uh, enough calcium. And in the menopause and in the menopausal transition, it's important to say, stay strong, right? Stay strong. Your lean body mass matters. Your strength matters. Your coordination matters. Your engagement and remaining engaged with the world really does matter, because while bone density is going to decrease as we get older, the rate of that decrease can be, which is to some degree genetically predetermined. That rate of increase, however, can be influenced by how we live our lives, right? How we how we exercise, how we stay strong, how we stay engaged in the world, how we live our lives. Bone health is the one area that you can absolutely speak with patients about hormone replacement and hormone therapy, because for patients who are at high risk, they really should consider, are my risks high enough for osteoporosis that I might consider using hormones specifically to ameliorate or diminish that risk, right? So I think that bone health is one of the things that I hope people are talking about before uh, their last or their final menstrual period. But if that's the first time you have the conversation, that conversation should include a discussion about staying strong, maintaining your lean body mass, maintaining, understanding what your family history is, being screened, right? Getting a DEXA scan when it is uh, appropriate, right? Based on risk factors, and really understanding that 20, 30 years ahead of the fracture is when we need to be thinking about it. I work with in prevention mostly. I refer and gladly and gratefully refer to metabolic doctors, which are endocrinologists, patients with osteoporosis. And if you have osteoporosis, not osteopenia, not just a diminishment in the in your bone density, but it has diminished to a point that is by definition osteoporosis. There are very good medical treatments available to build bone. When we had medications that we were excited about and we thought that their uh, prevention was really effective, we were very, and I was among the people who were very excited to prescribe those medications. The downside, the balance is not as high on the advantage as we thought. And so the discussions about preventions and maintenance of strength and health and well being in that regard have increased. One of the things I'm going to ask is about family history, because family history, it's significant. It's important for us to know if we should be focusing, if we should be turning our focus with like a bigger beam of light, right? Or is this a patient who I should be really maybe having them see a metabolic doctor earlier and seeing how we can kick up prevention? But for patients, I'm going to tell them first out the gate, get strong. And if you're already strong, stay strong. Your your lean body mass and your muscle health is really important. Lift heavy things, get your resistance bands, figure out what you can do. And it doesn't have to be fancy. It can be fancy if you like, but it doesn't have to be fancy. But lifting heavy things, getting those muscles strong, and walking about in the world are very important things to maintain your bone health. I'm going to ask them. Many people have dietary restrictions, so I'm interested to know what their calcium intake is currently. And I'm really interested to know historically what their calcium intake is. There are many populations who have higher rates of lactose intolerance. And in this part of the world, much of our calcium intake is linked to our dairy intake. And many people don't take in much in the way of dairy. I'm one of those people, of African descent. And those of us of African American descent, we have a high rates of lactose intolerance. And many of us, not all of us, but many of us don't have a high dairy intake. So getting a historical perspective of what their calcium intake has been like, right? Because we have to understand where you're starting from, because uh, bone density will decrease in the menopausal period. But where are we starting from? Trying to get a sense of that is important. Right? So those are some of the evaluations that I suggest. In addition, I think that bone density screening is an important evaluation. That evaluation is currently recommended at 65 years old, unless you have high risk conditions. Autoimmune disease is one of those high risk conditions. Steroid use is one of those high risk conditions. Family history is one of those high risk conditions. Low BMI is one of those high risk conditions. So, trying to stratify risks so that we can identify the patients who are at high risk, but all patients, giving them information, because this is a really important thing to know about for our future health and well being. I think that for women, a lot of the time, our focus on weight is about focus on thinness in our society. And it's really important to say, when I'm talking to you about your bone health, I'm talking to you about being strong, right? And being strong is important. Young women should know that being strong is important. Having opportunities to participate in sports to engage in regular physical activity so that it can be a part of your life, that's important and it should be encouraged. Again, thinness is part of the culture that we live in, and thinness happens to be one of the risk factors for bone loss as you get older. So I want my patients to be strong. I want them to have a healthy perspective about their uh, physical appearance and not fall into a trap of feeling that thinner is better. The truth in America, as it is in all over the world, is that you can be too thin and you can be too rich. Both are true. And I know that's not the common thoughts. You can never be too rich or too thin. Yes, you can be too thin and you can be too rich, especially maybe in America. But I encourage women to get to uh, a mentally healthy, physically healthy weight. But one of the things to measure that health by measuring their strength. I want to say to women who are postmenopausal and are concerned about their bone health, it is a time in which you are losing bone density. We all are. That's par for the course on the course that we're running. But there are things that you can do. There are treatments that you can take, which can help build bone, should that be necessary. And that would be, I would consider necessary for someone who is osteoporotic, someone who has got the diagnosis of osteoporosis. But for all people, whether or not they have the diagnosis of osteoporosis, it's a time to be maintaining your lean body mass, remaining engaged in the world so that you do not fall. It is a time in which your core and core strength is important. And osteoporosis, there are genetic factors, there are treatments, but osteoporosis is only one part of the risk. The second part of the concern and the greater part of the concern is the fall. And how do we prevent falls? There are exercises that are available, that are readily available now that we have access to things online to help you maintain your balance, to help things as simple as maintaining and seeing to your eyesight. Really important things to do as we get older because osteoporosis, as I said, there are many factors that go into it, but it's equally important for us to focus on fall prevention.